What's it like when you tell somebody that, yes, they're now doing well, but now's the time to get to work? How do you tell them? What is it like?
Yeah, normally I come in with a patient and tell them there's things I'm going to do for you. We've established flow and I've got these medicines and you're going to do really well with them. But part of it is the patient's decision. One, to be compliant with medicines. Two, to change bad habits, modifiable risk factors like tobacco use and dietary decisions. And then how do we get your heart moving again and get you exercising?
So cardiac rehab. What is cardiac rehabilitation? What do you do with that?
So the rehabilitation sometimes gets a little misnomer. We just think it's an exercise program, but really it's kind of a three-pronged approach. We try to tackle, yes, the exercise potential, but diet, tobacco use, all of those decisions that what people put in their body. And then there is a better known process of depression that happens immediately after a heart attack that needs to be taken care of too.
So depression is common.
Depression is very common after heart attack.
So in lifestyle changes, part of it is mental counseling or mental guidance?
It's a little bit of that, but you're again in a situation where everybody there has had a heart attack. Everybody's gone through the same thing, so it's a support group and mental guidance all at the same time.
So when I see people that've had a heart attack, they're scared to do anything. And so you say, we don't want you to do that. We've got to get things reestablished. I'm going to send you to cardiac rehabilitation. How many people end up going?
I think it depends on, one, how quickly we can get you in, okay? And we'd like to try to get you into cardiac rehabilitation within the first week.
First week after
after heart attack, yeah.
So you can get back and get with it within a week or so.
Yeah, and then again, that's the initial evaluation where we're going to take a look at how big this heart attack was. Are you high, moderate, or low risk for arrhythmias? We give you an exercise prescription and really give you the education. That's the most important thing up front.
So with exercise, what do you have the person do? To me, in cardiac rehab, you get on a treadmill and they decide how much stress to put on the heart. They keep you below that, and everybody else is there talking about their heart attacks and joking.
So we have different ways. We've got lots of people that aren't ambulatory. They can't walk after their heart attack, so we have hand bikes that they can use. It's not always treadmill. We have recumbent bikes, and so we can always get the heart rate up in some form or fashion.
So you want to get the heart rate up?
We want to get the heart rate up, but not too quickly, too fast. That there's an exercise prescription, and usually we go to about 75% of your max age-related heart rate. And so based on age, everybody's got a different target they need to hit.
So every individual is different. It's just not throw them in a cookie cutter approach. So what's the usual duration? How long is cardiac rehab? Is it 3 weeks? Is it 6 weeks? Is it 6 months?
The longer you're in it, the better you do. Now, insurance companies will give you about 36 sessions after heart attack before they may move you to a phase 3 rehab. And the difference between phase 1 and 2 and the phase 3 is the amount of monitoring that you get. For the first sessions, we put you on a cardiac monitor to make sure we don't have cardiac arrhythmias. Read a statistic, we save about one life for every 1 million patient exercise hours. But it does happen after heart attack, and if you have any rhythm disturbance while exercising, you want to be near electricity. You want to know that you have it immediately so we can get you back.